Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. It is Chesapeake Bay Week on MPT, and coming up, we will learn about the state of the Bay. But we begin tonight with our Your Health segment and some good medical news in the fight against COVID-19. Joining us are Dr. Michelle Gourdine, Senior Vice President for Population Health and Primary Care at the University of Maryland Medical System, and Mary Ghaffari, Director of Clinical Pharmacy Services, also at UMMS. Doctors, thanks so much for being with us. You know, the pandemic has obviously had a lot of bad news over the last year plus. The vaccines, the effectiveness of the vaccines being one bright spot, and also this treatment called monoclonal antibodies. Dr. Gourdine, could you briefly summarize just what that is?
Sure, happy to, Jeff, and thank you so much for having us. Yeah, this is some good news in COVID, and boy, can we use some good news. We've been dealing with this for over a year. Monoclonal antibodies are really the only effective treatment that we have for people who have tested COVID positive and have mild to moderate disease. And basically what this is a treatment that is made up of proteins that are developed in a lab, and they fight COVID infection. And so you think about whenever your body is infected, you develop antibodies that help your body to fight that infection. This is providing you with that boost through an infusion of lab-made proteins that help to prevent the virus from replicating or reproducing in your body, and thereby reducing the symptoms of COVID that would lead you to have severe illness or end up in the hospital. So in other words, if you have a test and you're COVID positive, you have mild to moderate symptoms, this treatment can keep you from going into the hospital, and it can keep you from getting to be severely ill. And that's really good news.
Who should get that treatment? I'm assuming it's maybe older people, it's people with existing conditions of different kinds.
Yeah, Jeff, that's right. So the treatment is targeted. The treatment, first of all, has received emergency use authorization by the Food and Drug Administration, or the FDA. And with that EUA authorization, they delineate specific criteria as to who can get this treatment or not. And so people who are 65 and over are eligible. Other people who may be younger but have certain conditions like high blood pressure or heart disease or have immunocompromised conditions are also eligible to get this treatment as well. If you are already hospitalized, then you cannot get this treatment. But again, if you meet those criteria and you have mild to moderate COVID disease, then you are eligible to get this treatment.
Dr. Ghaffari, when a prescriber prescribes the monoclonal antibodies, what happens at the pharmacy? It's not a pill you hand out.
Correct. So we do have infusion centers set up across our system as well as across the state that help with this. And so when a provider refers a patient to receive the monoclonal antibody, it is reviewed by our infusion centers and an appointment is set up. And a patient is then able to come to the infusion center and receive that medication. And so the pharmacy, prepares the medication in our intravenous laboratory where we will sterilely compound the medication, and then we deliver it to the infusion site for administration to the patient.
Series of infusions or a single shot? And I'm just picturing this room, and in the medical profession, you've all been dealing with a lot of people with contagious COVID, but if it's a large room, this is going to be a room full of people by definition with contagious COVID, right?
Yeah, so we have a lot of things set up to safely be able to provide this care to our patients. So you are correct. We do treat that when a patient comes to the infusion center, there are infusion centers that we treat our patients that do have COVID, and we put a lot of parameters in place for those patients to not only protect our patients, but also our staff. And so you would expect to see some of our staff in what we'll call personal protective equipment, or PPE, to protect them. But we also ask our patients, because they do have COVID, that is part of the EUA criteria to receive the medication, that they will wear a mask when they come onto the infusion center site and during the duration of the treatment. And you are correct, it is an intravenous infusion. And so they do receive an infusion of medication. It's not a single shot, but it is a single treatment.
Let me remind our viewers, if you have a question about this treatment, you can give us a call or send me an email. The email address is livequestions@mpt.org. Now, Dr. Gordine, if somebody does unfortunately test positive, how do they know if they could be a candidate for this? And what would the first step be?
Sure, that's a great question. So if you have received a positive COVID test, the first thing that we recommend that you do is to reach out to your doctor. And then your doctor is going to determine whether or not you meet the EUA criteria that we just talked about. And they will refer you to one of the infusion sites that Dr. Ghaffari just talked about, where you can receive the monoclonal antibody treatment. It's important that you get that referral from your doctor to receive that treatment, because the doctor will make sure that you're referred within the time frame where this drug has its greatest effect, which is in the first 10 days of your having any mild to moderate COVID symptoms. So again, you want to reach out to your doctor. Now, what if you don't have a doctor to reach out to? Well, we have an infusion site where we partner, the University of Maryland Medical System and Johns Hopkins Hospital partner at the Baltimore Convention Center Field Hospital, where we administer monoclonal antibody infusions as well. And there's actually a telephone number, which I'll read to you now to make sure I get this correct, so that if you don't have a doctor, that should not stop you from being able to get this treatment. You can call the Baltimore Convention Center Field Hospital at 410-649-6122. And they can guide you through the process and determine whether or not you're eligible to get the infusion. And if so, they can schedule you for an appointment to come in and get that monoclonal antibody infusion.
Doctor, you're just double checking the phone number, 410, and we'll repeat this at the end of the segment if time
Great.
permitting, 649-6122.
That's right.
All right. Let's take a phone call. Carroll County, this is Katrina. Katrina, thank you for calling. Go ahead.
Yes, I was calling right now. I'm at Sinai Hospital, and I seen you all on, and so I was calling my sister-in-law, trying to get a hold of her. But in the meantime, I want to know, how can I go by preventing me getting it? I'm stage 4 cancer, pancreatic cancer. Now I have liver cancer, and I need to know, what can I do?
Well, best of luck to you. We appreciate the phone call. We'll get you an answer on the air. Doctor, best prevention advice, that hasn't changed all that much, has it?
No, actually it has not. And so what we would say is, first of all, to your point, Jeff, prevention is absolutely key. So protecting yourself, wearing a mask, avoiding large gatherings, social distancing, and washing your hands is obviously extremely important. But what I would also say to Katrina is that she needs to have a conversation with her doctor about ensuring that she is able to also protect herself by getting the COVID vaccine. If in fact she becomes infected with COVID, then obviously she would need to have a conversation with her doctor about whether or not this infusion is right for her. What we tend to tell individuals is it is best to have that conversation with your doctor, because they can guide you to the best options to protect yourself from COVID. And good luck to you, Katrina.
Side effects from the monoclonal antibody treatment. And I'm wondering, from a pharmacy standpoint, was this something you already stocked? Was this approved for another condition, perhaps?
That's a great question. So I will start with, was this something that we already stocked? And the answer is no. These are very specific medications that were developed specifically for COVID. And so when the FDA approved them through the emergency use authorization process, that's when they became available for us to obtain them and stock them in the pharmacies across the country. In terms of side effects, they are really a very well-tolerated therapy. Most of our patients obviously have mild to moderate symptoms of COVID coming in, so they already don't feel great. They may have fever, they may have a little bit of nausea, they may have, the standard symptoms that we're hearing about. Most of the reactions that we hear about with the infusions or with the monoclonal antibodies are very mild. We have patients who will complain a little bit about some nausea during the infusion, maybe a little bit of fever and chills. It's somewhat hard to tell whether it's from the medication or whether it's from your COVID. And so we do monitor them when we are giving them the medication. Sometimes they can get a little bit of headache. Some more severe but very rare side effects are what we call infusion-related side effects, which may cause things like itching or rash, or some fevers, like I said, or maybe some body aches and things like that. And most of that can be managed in the infusion center with maybe an extra dose of medication like Tylenol or ibuprofen, and maybe some anti-nausea medication. Very, very rarely will that infusion-related reaction become severe enough that they need additional treatment. So it's very well.
Let's grab one more phone call. Peter in Frederick County. Peter, thanks for the call. Go ahead.
Hi, thank you for taking my call. There's a significant number of people that are refusing to get vaccinated. So this type of treatment gives them some hope. And will the demand exceed the supply of the monoclonal antibodies?
Very good.
It does come from
Thank you, sir, for the phone call. Time running short, but I'll get an answer to that. If everybody showed up who came down with COVID and tested positive, would there be enough to go around?
Right now, yes. The answer is yes. Across the country, the HHS, or the Health and Human Services, has procured enough medication for our country, and they are in charge of distributing it across the country to the various states, and then the states to the hospitals. And what I would say is across the country we have ample supply, and here in Maryland we have ample supply in order to be able to treat anybody who meets the criteria and their provider feels they are a good candidate and should receive the monoclonal antibody. Dr. Gordine, do you want to add anything on that?
No,
well,
Mary,
all we have
exactly
time,
right.
unfortunately. Dr. Gordine, I'm going to jump in because we're low on time, and I wanted to repeat the phone number. Double check me on this: 410-649-6122. But of course, the first stop needs to be your doctor's office.
That's right, Jeff.
Very good. Dr. Michelle Gordine and Mary Ghaffari, both of the University of Maryland Medical System. Doctors, thanks very much.
Thank you.
Now it is Chesapeake Bay Week here on MPT. Our Nancy Yamada reports on the Bay's latest report card.
The big driver on this report is rockfish, and the fact that it's been poorly managed for the last 2 years, and the numbers have taken a real decline.
Chesapeake Bay Foundation President Will Baker says the latest study that's done every 2 years on the Chesapeake Bay reveals some concerning news about rockfish.
Clearly, taking more fish out than nature can put back is not sustainable. So overfishing is part of it. And that's everything from commercial to recreational to charter boat.
He says rockfish numbers are also down due to global warming, which has raised the water temperature and increased dead zones where fish and other creatures die in oxygen-depleted water. Another problem? Fishermen that are mishandling rockfish even with good intentions.
A lot of fishermen will catch and return fish until they get the one they want. And if fish aren't carefully handled, they'll swim away from the boat, but then die afterwards. So we're seeing a lot of dead rockfish in the bay during the summer months.
But not all of the news is bad. Amounts of nitrogen and phosphorus, the two biggest pollutants of the Chesapeake Bay, are on the decline.
And that's good news. But they're still in overabundance, according to science. And science has set very specific limits for how much they need to be reduced by 2025, which is a self-imposed deadline. All 6 states in the Bay watershed have agreed to it. And each state has agreed to a pro rata share of the total amount.
Pennsylvania's been a large problem, particularly their agricultural runoff.
Senator Paul Pinsky, chair of the Education, Health, and Environmental Affairs Committee, says Maryland cannot meet the 2025 cleanup goals unless the federal government holds other states accountable.
I'm hoping the new Biden administration truly is committed to climate, to cleaning up our waterways.
The Bay Foundation joined several groups along with Virginia, Maryland, and D.C. and is suing the EPA for not taking stronger action against states that are not doing enough to curb their runoff.
There's slow degradation, which we have to reverse. We've taken some steps. And so I think we have to continue to pressure the federal government to step in Pennsylvania. But that being said, we still have steps Maryland should take.
Senator Pinsky wants to see a resurgence of the oyster population.
Besides oyster being a product for eating, it acts as a filter to the bay. So the more oysters we have, the cleaner the bay gets.
Though Maryland and Virginia are on track to meet their cleanup goals, Baker says the Bay will continue to be challenged by more intense storms due to climate change, which could lead to more runoff, sediment, and pollution. He says priority number 1 is to
maintain the progress and to implement the plan that Maryland, for instance, has already written. And if implemented, it will get the state to its promised reductions.
I'm Nancy Yamada for Direct Connection.
Nancy, thank you. Maryland's congressional delegation is pressing for a new designation for the Chesapeake Bay. Joining us is Reed Perry of the Chesapeake Conservancy. Reed, thanks for joining us.
Thank you so much for having me, Jeff. I'm delighted to be here.
Delighted to have you. They're talking about a national recreation area. What does that mean?
That's right. I'm excited to tell you about the proposal for a Chesapeake National Recreation Area, which would be our nation. It would be an official unit of the national park system that would be dedicated to the Chesapeake Bay. And this is something that we currently don't have here in the Chesapeake Bay. Folks at home know that America's national parks represent our country's most incredible natural landscapes, places of national and historic and cultural significance, places with outstanding outdoor recreational opportunities. We have all that and more here in the Chesapeake Bay. So this is really about getting that due recognition and being able to fully benefit from and leverage the power of the National Park Service to link together places that currently exist, existing state parks and local parks, national park units like Fort McHenry or Harriet Tubman Underground Railroad or Fort Monroe in Virginia, create new visitor centers, new park areas for the public to access and experience the Bay and enjoy that all it has to offer, bring in the economic benefits of that come along with a national park unit, enhance the storytelling around the culture and history of the Chesapeake Bay, and lastly, and importantly, inspire the public to protect the Bay for generations to come.
Reed, has there been some sort of half step in this direction? I've heard over the years more talk about involving the Park Service.
Yeah, so this is an idea whose time has come. You know, the idea for a national park for the Chesapeake Bay actually goes back decades. And in the past 30 years, the National Park Service has entered the Chesapeake Bay and really grown and evolved. So the National Park Service has a Chesapeake Bay office, and they operate the Chesapeake Bay Gateways and Water Trails program, which provides financial and technical assistance to communities throughout the Bay for public access, for educational programming, for interpretation. We have the Captain John Smith Chesapeake National Historic Trail, which is our nation's first water-based national trail. But we don't have a unit of the national park system. And so we are unable to really fully benefit from and leverage the power of the national park system here in the Chesapeake Bay.
I'm not telling you anything that I'm not telling you anything you don't know, but people love the National Park Service. I love the National Park System. I've been to some of the, the big famous parks. I've been to some little out of the way, crazy little places, and they all attract interest, and there's always a place. So where's the place going to be? Because the Bay has, I don't know how many thousands of miles of shoreline, and I think there's got to be a ranger station somewhere, right?
That's right. That's right. There's certainly going to be a place. And I think the beauty of this model is that there are places that already exist today, existing state parks, local parks, as I mentioned. There's existing national park units. All of these places can be connected by the designation of a Chesapeake National Recreation Area. And in addition to that, we are looking to create some new places. So as I mentioned, visitor centers, new park areas. Right now, we're looking at Annapolis, Maryland, and in the Fort Monroe, City of Hampton area, Virginia, to start. Long term, our vision here is that we will have places throughout the Chesapeake Bay. So we will have kind of hub communities throughout the Chesapeake Bay for additional public access. But again, this is really about taking advantage of what already exists and creating a coordinated visitor experience and really a national park worthy visitor experience. And the model that we're really working off is Golden Gate National Recreation Area in San Francisco, which is represented by lots of different amazing units and places. It includes Alcatraz Island, the Presidio, Muir Woods. These are all kind of different places, geographically separate, but they're all united under that designation. So we want to do that here in the Bay.
Yeah, I've been to all three. It's all very cool stuff, and hope we can get that sort of attention. Draw a line for me from getting the added attention, the added visitors, which you would think might be a negative, because after all, it's having a lot of people around that's messed up the Bay. But if we bring more people in, how does that help the Bay?
Certainly. So of course, with a national park designation, we would expect to have more tourism. But I think it's important to note what the focus is here. And this is about the Chesapeake Bay, and there's a real focus on sustainable tourism. This will be a land-based park primarily. And I think that overall, this is going to really serve to inspire everyone who visits this park to join in the effort to restore and protect the Bay, which is really important. And I think secondly, we need to tell the story about the restoration effort, which is currently not really being told at a lot of our parks here in the Chesapeake Bay.
Reed, you may know all of us on the Direct Connection team are big fans of the Conservancy's Osprey Cam. We've talked about it a lot over the years. I looked at it this afternoon, and the Ospreys are an incredible story of resilience and rebirth now that they've been protected and chemicals have been done away with in their territory. So I looked today, 2 birds in the nest, no eggs yet.
That's right. That's right. So we have Tom and Audrey that are in the nest. It's a new Audrey this year, but they're nest building, and we're hopeful that we'll see some eggs very soon. And we are very grateful for the millions of viewers that watch our wildlife webcams, and we're grateful for that crazy osprey family that take care of the nest over on the Eastern Shore.
Reed Perry of the Chesapeake Conservancy. Reed, thank you very much.
Thank you, Jeff.
Wednesday at 8 o'clock, MPT presents the 2021 Chesapeake Bay Summit. Here's a preview.
Climate change, at least in the mid-Atlantic area, will probably get more rainfall and more intense storms. Trying to look at the effects of climate change on the monitoring data. In some places where we have over 30 years of information, we can see increases in the amount of flow due to climate, and we've seen increases in the water temperature. That will affect the amount of nutrients and sediment coming down. That is, we'll get more pollutants being washed down from the land to the rivers.
Now, the Chesapeake Bay program computer model says climate change will make cleanup something like 10% more difficult than was thought when the goals were first established. So, Karen, let me come to you. Are there plans to update the goals to reflect the science and the climate change?
Yes, so we're learning every day about climate change and the impacts of climate change. It's complex, and we know a little bit. We're hoping by 2025 we can relook at what it's looking like for 2035 and so on. Climate change is going to be here for a while. Its impacts are going to continue for a while, and we have to do more things that allow us to be resilient to that climate change.
The Bay Summit airs Wednesday night, 8 o'clock on MPT, and a full list of Bay Week programs can be found at mpt.org/Bayweek. Coming up Friday on State Circle, a special Chesapeake Bay edition of the program. We'll talk about the problem of plastics in the Bay. We'll look at how the Inner Harbor trash wheel is intercepting so many plastics, but once they get by, how they begin to degrade and affect creatures of all kinds, not only in the Bay, but in our oceans as well. Hope you join us for that Friday at 7. Now, for all of us at MPT, thanks for watching Direct Connection, and have a good night.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.